Hello, welcome to Acharya Nidana Academy. So far we have discussed chief complaints, history of present illness, past history, treatment history, family history, and method of inquiry in family history, etc. Today we are going to discuss the personal history of a case taking format. So when you say about personal history, these are nothing but the details of the uh, individual, details of an individual. That means the person's diet, nature of diet, pattern of food intake, and sleep patterns, and regarding the occupational, uh, that is in terms of the work, etc., and in terms of the any specific habits, they are going to be discussed here. So maybe related to even sleep patterns also. Some of the other aspects such as bowel movements and the micturition related the events, etc., they are going to be discussed here. When you think about the food related pattern, first of all we are going to see the regarding the ahara. That means what kind of ahara he is going to take. So regarding the before that particular ahara, so we are going to see what is the status of the digestion capacity in his perfect normal health and in the present day. That is going to be discussed here. Whether is it pravara or madhyama or avara, that will be discussed or that will be inquired there. So that means if the person is having the consumption of food, say for example at 8 o'clock in the morning, so at what time he will be getting the hunger? That means he will be getting the perfect, would you say that the features of the digestion. So that is kuksha apratipedanam aharena. It should not be producing more and more discomfort to the kuksha or abdomen. Hridayasya anavaroda. It should not be giving the undue discomfort to the chest. Parshva Abhipatana. It should not induce the discomfort on the sides of the chest and abdomen. In that way, so Matravad Aharana Lakshana should be there, and person should have proper Jirnahara Lakshana. The text says, Udgara Siddhirutsaha Vegotsarga Yathochita Laghuta Kshit Pipasa Cha Jirnaharasya Lakshanam. Udgara Siddhi, Utsaha, Yatha Uchita, Vega Utsarga, both Mutra and Purisha, and other Vega, Laghuta and Kshut and Pipasa at proper amount of time. So that should be present whenever if you are saying the person is having the proper Charana Shakti. If that is happening at appropriate time, so we have to see whenever if a person is taking the breakfast at 1 o'clock, at 8 o'clock, by 1 or 1 p.m., 1:30, etc., person will be getting the hunger. And by and around 7 o'clock, he will be getting the appetite for the dinner as such. In that way, if the person is having the same kind of the patterns, then we are going to say the person is having pravara jarana shakti. If the person is not able to digest, so that will be categorized under avara shakti. In between, we are going to say the person is having madhyama. That is the what is that? Madhyama ahara shakti as such. So we are going to analyze what is his previous state and what is the present state. And further, we are going to see whether Ahara Vidhi, whether he is having the regular or irregular. In the sense, he is having the consumption of diet regularly at 8 o'clock, or Sometimes he is going to take the breakfast at 8 o'clock, and some other time he will be taking the breakfast at 9:30. Sometimes he will be taking the breakfast at 11 o'clock, etc. Then in that particular situation, it will be an irregular Ahara Vidhi. For that, we have to inquire what is the gap between the two consumptions or two meals. So in between the two meals, what is the time gap? So suppose is it 2 hours or 4 hours or 6 hours? In that way, we are going to inquire that. Further, we are going to see what is the frequency of meals per day, whether he is going to take the meals at 3 times or 4 times or more. That has to be checked. Suppose if the person is taking the breakfast at 8 o'clock, he is going to take the consumption, there is the tea with snacks at around 10:30 and lunch at around 1 o'clock. 3:30 he will be taking the tea with snacks, and at home he is going to take the tea, and at around 7 o'clock he is taking the dinner. Nearly 6 or 7 meals he is going to take the food as such. So that is what do you say, that responsible for the Agni Mandya as such. Further, whether he is doing the upavasa or fasting or not, that has to be inquired. You need to say what kind of the pattern of fasting. Some people used to do fasting every Monday. Some people will do every Thursday. Some people will do every Saturday. Some people will do only the water portion will be consumed by the people. Some people will do absolute fasting, even the water will not be consumed. Sometimes some people will do fasting on every fortnight. For example, the Ekadashi fasting. Some people will do once in a month. Some people will do fasting on specific festival occasions. Sometimes it may be followed a week daily. Sometimes it may be followed 30 days. Sometimes it will be done for 1 day. In that way, so you have to inquire whether the person is doing the upavasa or not. That has to be inquired. Further, you need to inquire about the asatmya with reference to ahara. Whether the person is going to take masha items or the black gram items such as idli, dosa, etc. Sometimes some people may have the aversion or the allergic reactions to brinjal. Some are having the allergic reactions to milk, or some people may have allergic reactions to spicy substances. In that, like that, you have to inquire what kind of the asatmya, whether the person is having any kind of the specific allergic reactions to any specific substances has to be inquired. Some people are having the aversion to groundnuts, etc. Atyashana. If the person is doing atyashana, as per the Ayurveda, it is being mentioned that may be responsible for the tridosha vitiation. Sometimes consumption of milk with the fish together, it is considered to be asatmya itself. Consumption of gobi biryani and ice cream. Gobi manchuri is having the ushnavirya. And when you think about ice cream, so by touch it will be shita as such. And in that way, that is having the virya viruddha actions can be identified. When you think about the certain examples, whenever if a person is taking frequent samosa consumption, which is usually responsible for the katur, it is usually katurasa pradhana, which may be responsible for the vitiation of pitta and vata itself. This may be responsible for the rajasika rajoguna to increase. In that way, there may be a possibility of rakta, sweda, and asti affliction. This is usually attributable to the ashraya and ashrayi bhava. Whenever if a person is having frequent dadi consumption, that may be responsible for the increase of either tamasika or rajasika bhava. If it is if a person is consuming dadi with madhura rasa, such as the sugar, etc., in the form of lassi, there may be a possibility of increase of kapha dosha prakopa or tamasa guna vriddhi there. If the person is taking the dadi, which is having amla rasa, along with the lavana, that may be responsible for the increase of pitta dosha there. Rajasa guna vriddhi may be present. In that way, there may be a possibility of affliction of either rasa or ratta, etc. is going to get vitiated there. Whenever if you see the impact on Agni, if it is kapha dosha prakopa, there may be a possibility of a mandatva of Agni is going to get enhanced. So that means the person may have mandagni. In case of the person who is consuming the amla or lavana rasa yukta dadhi, etc., there may be a possibility to increase of tikshnatva in the Agni as such. Frequent idli consumption. This may be responsible for the amla, or as it is that may be having amla or lavana pradhanata. There may be a possibility of pitta dosha increase. Rajo guna vriddhi may be present. Thereby there may be a possibility of affliction of either rakta or sweda. Frequent alu paratha consumption, which may be having either katurasa or lavana rasa pradhana, there may be a possibility of rajas guna to be get increased. Thereby pitta may be increased to a larger extent. Kapha dosha may be increased to a lesser extent. Thereby there may be a possibility of affliction of either rasa or rakta affliction we are going to see. As far as Agni, when you say about the Agni, we need to identify whether it is Mandagni, Samagni, Tikshnagni or Vishamagni. When do you say it is Mandagni? Even the small quantity of regular meal, which is easily digestible, may take a longer time to get digested. And the person feels reduced appetite for the next scheduled meal, then we are going to say he is having Mandagni. If the person is able to have the proper appetite and digestion of the meal at a proper amount of time, then we are going to say he is having Samagni. If the person is having the digestion of the food quickly and even the heavy meals consumed is going to get digested easily before the next scheduled meal time, then we are going to say the person is having Tikshnagni. Whereas the irregular phase of digestion as well as indigestion, which may be associated with regular bowel movement and the person is having constipation, in that particular sense, the regularity in the movement of the small intestine as well as large intestine may be impaired or may be altered and may be unpredictable. We can say the person is having Vishamagni. When you think about the Mala Pravritti, so we need to inquire about the different parameters. Frequency. How many times per day the person is having the bowel movements, whether once a day or twice a day or 3 to 4 times a day, that has to be inquired. Any change in the recent bowel habits may attract clinical significance, otherwise it's not having much clinical significance. As far as consistency is concerned, he will be having atigrathita, so that means very hard stool. The person who is having the habit of constipation, or the person is actually neglecting the nature's call frequently, in old age individuals, they will be having very hard stool. Whereas atidrava pravritti will be observed if the person is having increased peristaltic movements, such as inflammation of the small intestine or large intestine. Whereas pichila type of the Mala Pravritti, so that will be considered to be due to the presence of fat, such as steatorrhea. The person who is having the hepatobiliary dysfunction, wherein the bile salts are not going to come into the small intestine, into the duodenum, which is actually responsible for the movement of these fat in the fecal matter, which is being termed in the current Western medicine as steatorrhea. Whereas if the large intestine secretions are going to get increased because of high irritative substances consumption, for example, very spicy substances consumption, so this may be responsible for the increased mucus secretion. This is also responsible for the pichalatva of the mala. In this way, so consistency has to be checked. The normal consistency that is being considered as pultaceous. When you say pultaceous, that means it will be having the cylindrical shape, and if you press the fecal matter, that will be producing a dent, and that will not be disappeared. So that is what we can see, the pultaceous consistency. And when fecal matter is having this particular consistency, then we are going to say is having the normal Mala Pravritti. As far as color and appearance is concerned, Tilapishta Nibham, in the sense it is considered to be pale or clay color, that is considered to be due to the absence of the bile in the alimentary canal. So that means he will be having the hepatobiliary dysfunction, that too post-hepatic jaundice or obstructive jaundice. Say for example, in case of carcinoma of the pancreas or cholelithiasis, etc. conditions. Whereas Pita Varna that will be observed because of the presence of the bile in the fecal matter. Shava Varna or blackish discoloration can be observed when the person is having the bleeding in the alimentary canal, specifically in the stomach, wherein hydrochloric acid will be mixing with the blood, leading to the black colored stool. Of course, if the person is having the chronic constipation, then also there will be a possibility of blackish colored stool. For that, you have to differentiate it by doing the appropriate history as well as physical examination. As far as Rakta Varna Purisha will be observed in cases of profuse bleeding from the lower alimentary canal, particularly in the sigmoid colon, rectum or anal canal. When there is the bleeding in the anal canal, so that will be having the streaks of the blood on the sides of the fecal matter. In that way, we are going to see the Rakta Varnaja Purisha. Whereas Harita Varna, this may indicate the presence of biliverdin there. And any other appearance as well as the color, etc., we are going to inquire and you are going to observe, write the observations. As far as Sama and Nirama Purisha are concerned, the presence of Sama Purisha is indicative of the presence of macromolecules from the stomach or small intestine that will straight away entering into the large intestine, and that will be entering into the rectum itself. So that means that indicates the absence of a proper digestion in the alimentary canal. So as far as Pravahika is concerned, the tenesmus refers to the urge of defecation. If the person is having the frequent urge even after passing the bowels, then it indicates the person is having the tenesmus. Plus, that will be associated with excessive mucus secretion. That is indicative of a excessive irritation is happening in the large intestine. So that has to be inquired there. As far as evacuation of the Purisha is concerned, whether the complete evacuation or incomplete evacuation is being present or not, that has to be inquired. If it is incomplete evacuation in the sense, that is usually indicative of a Krishna Purishata or the difficulty in passing the stools. For example, person who is suffering from some fissure in anal, wherein there will be the mucosal damage to the anal mucosa, which is actually responsible for the incomplete evacuation. The reason is the person will be having the very severe pain after defecation. So that means the person will be voluntarily suppressing the urge of defecation in that particular situation. As far as fecal incontinence is concerned, the person who is actually unable to withhold the urge of defecation. As soon as the fecal matter enters into the rectum, it will be straight away, it will be coming into the anal canal. In that way, that will be expelled to the exterior. And any other complaints as such, that is, as we have discussed in the cases of what is a fissure in ano, the person will be having the very severe pain soon after the defecation as such. As far as Mutra Pravritti are concerned, so we are going to see regarding the frequency at daytime, whether the person is passing the urine 3 or 4 times or 5 times. You are going to write in the observation part. Frequency at night, usually the people will be passing the urine only around once or maximum twice at the night time. More than that, that may indicate the urinary disorders itself. As far as stream is concerned, whether is it forceful, in the sense it is indicative of the urgency, large amount of the urine that is being accumulated in the urinary bladder, that indicates. Weak in the sense that may be indicative of the weak sphincter itself. Dribbling in the sense that may be indicative of urethral strictures as such. And narrow flow, that indicates the person is having the, what do you say, that the prostatomegaly, etc. As far as color is concerned, normally the urine may have either pale yellow color or amber color or sometimes brown colored urine. Dark yellowish urine will be observed in case of obstructive jaundice or hepatocellular jaundice, whereas pink or reddish colored urine will be observed in cases of hematuria or hemoglobinuria, or when the person is consuming the beetroots. In those situations, there will be a pink or red colored urine. So, whereas orange colored urine, so that may be sometimes even the normal urine that can be seen. Whereas burning sensation in the urine or during micturition indicates the person is having urethritis. Whereas other lower urinary tract symptoms such as hesitancy, poor or intermittent flow, etc., or straining for micturition or prolonged micturition, or feeling of incomplete bladder emptying, all these are indicative of obstructive symptoms, and that is indicative of the person is having the benign prostatic hyperplasia. And any other symptoms as such, when you think about it, is there any hematuria is being present, or is there any dysuria is being present or not, that we are going to check. Or is there any urge incontinence, or specifically nocturia is being present or not. And nocturia refers to increased micturition at night time. This one has to be differentiated from diabetes mellitus and congestive cardiac failure. In case of diabetes mellitus, the person may have the increased frequency of micturition both in daytime as well as nighttime. Whereas person who is suffering from congestive cardiac failure, in daytime he will be having less micturition frequency, whereas at nighttime that will be more. In that way, based on the symptoms, you are going to differentiate the presenting or diagnosis as such. As far as Koshta is concerned, so we are going to see whether the person is suffering from Mrudu Koshta or Madhyama Koshta or Krura Koshta. How to identify Mrudu Koshta? When the person is passing the stools easily with weak laxatives or consumption of ikshu, that is sugarcane, milk products, sarpi or ghee, draksha or the what do you say that the draksha phala or ushna jala or simple warm water, then we are going to say the person is having mrudu koshta. Whereas the krura koshta is the one where the person will be passing very hard stools, and if at all if a person passes it, he will be having the difficulty, that is he will be in the sense he will be having constipation, and he requires laxatives, that too the Tikshna Virechana drugs to pass the bowels. Then we are going to say that is Krura Koshta. Whereas Madhyama Koshta lies in between these two categories. So in that way, Koshta assessment has to be done while doing the personal history. And think about work. In the sense, you need to identify the nature of work, what kind of work he is frequently doing, whether is it sharirik or physical work, or manasika or mental work, or vachika, having more and more speech as such, what kind of work he is consuming or doing. So regarding the timing or duration of work, how much time duration he will be having the work, whether is it doing 9 to 5 job or 5 to 9 job, or whether he is having specifically in daytime job or nighttime job or evening time job, etc. That has to be inquired there. That means in case of if there is any shifting of the duties are there or not, that has to be inquired. Sedentary lifestyle, whether the person is having sedentary work. For example, the shopkeepers, specifically who are sitting in the galla, they are usually having the sedentary lifestyle work. Whereas exertional work, that means the people who are doing the manual labor, etc., they will be having the exertional work as such. Whether he will be doing whether physically or mental exertional work, or both are mentioned, both are done by the individual, etc., that has to be inquired there. So whether the person performs the work up to one's Artha Shakti or beyond Artha Shakti, etc., that has to be inquired. When the person is doing the work up to Artha Shakti, that is actually being said to be the normal work pattern or exertion or Vyayama is being mentioned by the Ayurveda fundamental. And if a person is doing the more amount of work, then that is considered to be Ati Vyayama. Whether the person is doing the activities up to one's capacity or more than that, that has to be inquired there. And any kind of the asatmi related to vihara, such as atapasevana, in excess, if the person is doing or not, that has to be inquired there. Well, think about the nature of work. So this particular information is available in the Ayurveda, the Roga Nidana workbook as such, that is being published by the regulatory body. So these are the informations that are being considered to be indicative of manual labor, such as lifting heavy weight or carrying heavy weight or pushing the heavy weight or pulling, grasping, etc. or the repetitive movements such as repetitive lifting, such as the masons, continuous bending, prolonged standing, such as the people who are having the profession of either teaching or traffic policemen, prolonged standing, frequent kneeling, etc., that are being inquired there. As far as fine motor skills, precision tasks, or small object manipulation, etc., that is when you think about it, these are the very skilled activities. That means which require it is not requiring physical work, which is the extreme physical work. They are usually requiring the, what do you say, that the sedentary work style. When you think about the sedentary work, some other works are there, such as desk work, such as the clerical job, computer based tasks, that is sitting in front of the computer as such, and administrative duties. As far as outdoor work are concerned, exposure to weather conditions, physical activities related to the, for example, the lifting the heavy weight, etc., in various climates, that are going to come here. As far as field work are concerned, that is the machinery handling, such as the road construction, etc., vehicle driving, etc., that are the field work, that is wherein the people will be suppressing the urge of defecation for longer amount of time, specifically in case of heavy truck, the heavy vehicle drivers. Such as the next comes the field work regarding construction work, that is building the structures or demolition work or carpentry, etc. As far as healthcare professions, such as patient care, so that means the hospitals, medical procedures, so that means specifically the surgeons, etc., who are doing the surgeries up to hours together, so 6 or 7 hours together in that particular situation, that is they have to be inquired there. As far as agriculture work are concerned, farming activities in the field, such as plowing or the planting the crops or the growing the plants, etc. Animal care, such as pets, the caring the pets, etc. Whereas service industry, that is customer service roles, retail tasks, etc. Athletic and sports activities, such as the cricket, tennis, etc. Coaching activities, etc. As far as educational field are concerned, regarding the teachers, such as making the lecture, etc., classroom activities or laboratory works. These are the different natures of work. They are coming under the heading of nature of work as such. That has to be recorded in the your nature of work category. As far as Nidra is concerned, so the status of Nidra, that has to be inquired, whether the person is having normal sleep or excess sleep or reduced sleep. If disturbed, whether the person is having difficulty getting the sleep or difficulty in maintaining the sleep or early morning awakening is being present or not, that has to be inquired. As far as duration of hours of sleep in day and night, that has to be inquired. In case of the day, what is the number of hours of sleep at daytime? In case of night, what about the hours of sleep at night time? How much time, how much hours the person is having the awakening at night time, that has to be inquired. As far as Vyasana is concerned, we are going to ask about the Vyasana in terms of smoking or the cigarette smoking, etc., or alcohol consumption, tobacco chewing, screen time in the sense that is watching the videos or the movies, how much time he is going to do this, that has to be inquired. And any other addictions are there or no, that has to be inquired. And that has to be mentioned along with duration with quantities also. Based on that, you have to inquire the the affliction of either Sharirika dosha or Manasika dosha. For example, let us say if the person is doing the excess alcohol consumption, so that means the person may have the the liver damage in due course of time. That means there may be a possibility of yellowish discoloration or ascites development, etc. that can happen. So that means there may be a possibility of affliction of a pitta dosha or kapha dosha later. Tobacco chewing continuously may be responsible for the affliction of the mouth, etc. Thereby, there may be a possibility of a vata dosha vitiation at that particular time period. So, the take-home messages from today's discussion are: we are going to say personal history as Vayaktika Vrittanta, wherein we are going to note regarding the personal habits of an individual in relation to appetite, in relation to the nature of food intake, sleep patterns, bowel movements, micturition movements, and occupation related details and other habits related details are being checked. Based on the information obtained, we are going to identify what is the dosha involvement is being observed in the individual that are going to be checked. And based on that, we are going to analyze what is the strength of the disease as well as strength of the patient is going to get analyzed. That's all for today. Dear ANA members, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you would like to hear in the coming videos? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.